So to prepare for laser hair removal treatment, you want the area to be treated to be shaved. So I'm going to go ahead and do a little bit of shaving here. It does help to ask your patients to go ahead and shave the area that they want treated 24 to 48 hours before they come in to save you some time in the clinic. And you also want to warn your patients to shave only, that shaving is okay, but no waxing and no plucking, because you do need that portion of the hair that's still underneath the skin for the laser hair removal treatment to work. So after I've finished shaving the treatment area, I also clean it off with some alcohol, just to remove any residual skin oils and residue. And you can see I've also marked some areas out with a white pencil, marking the areas that I want to treat up to. You always want to use a white pencil instead of a dark pencil like brown or black, because white pencil is invisible to the laser. So Sean is a Fitzpatrick type 2, so I've set the laser according to his skin type, and also for Fitzpatrick type 1 through 4, you have the option of using a 1064 long pulse for laser hair removal or an Alexandrite 755 for laser hair removal. And I'm choosing to use the Alexandrite 755 wavelength for Sean's laser hair removal because it does usually hurt less than the 1064 long pulse wavelength. So basically I'm going to cover the entire surface area that contains hair that we want to treat or get rid of. And it's going to feel like little flashes of heat that are tolerable for most people. Okay, ready? Go ahead and chin up a little bit for me. I'm going to get this area first right here. Okay, here we go. Doing okay so far? Mm-hmm. Okay. Also with the Quanta lasers for laser hair removal, the manual has settings for either thick hairs or thin hairs. The hairs that we're treating on Sean today are sort of in between. They're not terribly thick, but they're not terribly thin either. So I've chosen settings accordingly. For instance, for the pulse duration, I chose kind of an average pulse duration, but if you're treating very thin hairs, you want a short pulse duration because you want all of the energy delivered in a short amount of time very quickly, versus for thicker hair, you want to choose a longer pulse duration so that the energy is delivered a little bit more slowly. For instance, cooking a steak, if you will, a thick steak, you don't want to heat it up real fast, you want to cook it more slow. So that's sort of how I think of it with a thicker hair. So Sean, how does your skin feel now after the treatment?
So it feels like I got a little burn, maybe didn't put on too much sunscreen when I went out to the beach.
Okay. So it feels like a mild sunburn.
Exactly.
Well, that's totally normal, and that sensation will last about 2 to 3 hours, and then it should dissipate and go away. If it's uncomfortable for you, you can certainly take some Tylenol or ibuprofen. That's totally appropriate. And then your next treatment will be in about 6 weeks, and that'll allow time for the next phase of hair growth to come out, and then we'll treat those new hairs or new hair growth. You don't have to do anything special with the skin, so you can shower as usual and use your normal soaps and everything as usual, or any lotions that you might use. Sound good?
Sounds great.
Okay,
Thanks so much for the treatment
You're
today.
welcome.